The health services north and south are facing into another difficult winter. Overcrowding in our hospitals gets worse by the year. There are more than 700,000 people on acute hospital waiting lists, and most of those are just waiting for an appointment. Waiting times to see a GP in the south are longer than ever, and it's the same in the north. And out-of-hours services have virtually collapsed. We are not training enough healthcare workers, and many of them that we do train are emigrating. The two-tier health service in this state has failed. Fianna Fáil and Fine Gael, when it comes to healthcare, have failed. But we in Sinn Féin have a vision for change. We are a party brimming with ideas, evidenced in the motions from all corners of the island of Ireland before us this weekend. We have a plan to fix the health service. Sinn Féin will reverse privatisation and outsourcing. We will invest in frontline workers and capacity. We will invest in smarter ways of working. We will invest in modern systems for accountability. And we will drive reform and deliver real change. Of course, our health services need greater efficiencies. We all know that. And this party has been calling out that for some time. There is significant waste in the health service, but whose fault is that? Fine Gael have had 13 years to fix the problems in healthcare. But the truth is, the longer that Fianna Fáil and Fine Gael are in office, the worse that the health service has got and will continue to get. It is time for them to step aside, and it is time for a new government of change. If Sinn Féin gets this chance, we stand ready to hold the health service accountable and to give our talented healthcare leaders the tools that they need to get the job done. And most important of all, Sinn Féin will drive on a relentless march to universal healthcare. Sinn Féin will expand medical cards to 400,000 more people in our first year of government. We will reduce the monthly maximum cost of medicines to €50 and abolish prescription charges for all. We will achieve universal healthcare within 2 terms of government in preparation for Irish unity. Sláinte de Care laid out the vision for universal healthcare in the south. The Ben Gore report provided solutions for modernising the health service in the north. Sinn Féin is committed to those programmes of reform. We will build an Irish National Health Service that leverages the potential of our all-island population. We will transform the failing child and adolescent mental health services into a new world-leading child and youth mental health service that recognises the need for specialist services up to the age of 25. We will invest in education and in primary and community capacity to shift the focus to early intervention and prevention to improve quality of life and reduce ill health. We will mainstream care for the elderly, address severe deficits in home care and reform the health service to respond rapidly to care needs in the home. We will prioritise independent living for people with disabilities and ensure that they have access to their therapies when they need them. Our focus will be on building public capacity in a public system so that all patients will be seen when they need it on the basis of need and not on ability to pay. The Southern Government lacks vision and ambition. It always has when it comes to healthcare. In fact, they have privatised most of it. It is out of touch and out of ideas. But Irish people are standing up and saying enough is enough. Enough of the two-tier health service, enough of the years-long waiting lists, enough of Fianna Fáil and Fine Gael. More and more people are seeing Sinn Féin as the party of change. Sinn Féin is the party that will prepare our health services for a united Ireland. Together, Accarja, we will deliver the change in healthcare that our people need and deserve. Gurla Míle Máel Gaibh.